Post-Brexit reliance on NHS staffer from red list countries is unethical, Streeting says. We're going to read into this exclusive from The Guardian, you guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is Reganelite here, an exclusive from The Guardian with the headline, "The post-Brexit reliance on NHS staff from red list countries is unethical," Streeting has said. The exclusive reveals that NHS England has dramatically increased recruitment of workers from states with critical medical staff shortages. Guys, while you're here, make sure you hit that like button and share it across social media so others are notified of this video. Since, obviously, we left the European Union and the single market, we have become, we've not been able to have the doctors and nurses that we normally get from our European neighbours and allies. It's much more difficult for them to come to the UK to work here now. So most of them have stopped coming. And it really happened a lot during the pandemic, because when the pandemic struck, a lot of people went back to their home countries, obviously, before everything really went all hell broken loose pretty much then. And during that period, obviously, we found ourselves more and more short of workers. I think it's fair to say that there was already over the last since 2010 that there has been a reduction in workers because of this Conservative government with the austerity and the cutting back on things, because that's what the Conservatives were doing. They were cutting a lot of things. Even though that they were saying they were doing a lot of investing, they were also adding bureaucracy and cutting back within the National Healthcare Service as well. Even though they claim that they've invested record billions of pounds and whatnot, you weren't seeing that making the change there when it comes to our healthcare system. Now, obviously, since all of this now, we're in a position where the National Healthcare Service, and we'll talk about England in particular, I can't speak too much on Scotland and Wales, Northern Ireland, but in England in particular, it is crucial that we have the workforce that we need to be able to basically have a healthy work, because without a functioning properly healthcare system, it affects our economy, it affects workers, it just forces more people onto disabilities. Hence why we have the situation where we have a lot of people who desperately need the healthcare service that they need, because it's been crisis after crisis, especially during the winters for our National Healthcare Service. Now, I've said to you guys already on a number of occasions that we have to give Labour a chance to see what they can do with our NHS. And I'm waiting to see at the end of this year how the NHS has coped for more than a year since this Labour government have taken it over. That's what I've said I wanted to do. I'm not... They are planning to scrap NHS England. Now, this was something that was introduced by the Conservatives. Wes Streeting, the Health Secretary, called it just a quango more bureaucracy. I don't know if it's right for me to call that. I don't know enough to say whether that is right or not. Excuse me. What I do know is that we need to make sure that we have the right workers for the National Healthcare Service. One thing that is clear, and because of the red tape that we have with the EU, we have to rely on workers outside of the European Union, and that means getting them from Africa, from Asia, from countries that are not so suitable, really. And as frustrating as it can be, it's easy for people in the comments section to basically say, well, we should be training our own. Well, the problem is that for many people who do train in the UK, who are born and raised in the UK and trained to become doctors and nurses, the problem is that the pay is crap. And what tends to happen is, and there's many examples out there where some of them have just basically either gone to the private sector because they'll get more money for the private sector, or they've gone to another country because they've earned more money. So if you want our doctors and our nurses and other workers to stay within the NHS workforce, you want them to stay British and born and whatnot, we've got to pay them more, because what we're paying is not anywhere near enough. So we're having to rely on workers abroad to plug the gaps. Because building up your own workforce, sorry to tell you this, it takes time to do so, guys. It really does take time to do so. It's not something that can be done overnight. But they are making massive overhaul changes, Wes Streeting is doing with it. And I completely understand the criticisms of it, and I totally don't trust Wes Streeting in any way, shape or form. I've said this on numerous occasions. But like I said, we need to see the results. And there's one result that you can't deny, and that is waiting lists have gone down. Waiting list has gone down under this government, and they deserve credit for that, whether you like it or not. Now, it's still nowhere near the levels that we want it to be, but it shows to me that they are making some positive steps when it comes to the National Healthcare Service. But like I said, we'll have to wait and see more at the end of the year before I can be more judgmental on them. So, let's read more into it. So, Brexit has left the NHS increasingly dependent on doctors and nurses from poor red list countries, from which the World Health Organization said it is wrong to recruit. So, they're saying it's wrong to recruit. Well, the thing is that unless we make it easier for European nations to recruit doctors and nurses, it's kind of hard for us and not kind of hard for us. So the health service in England has hired tens of thousands of health staff from countries such as Nigeria, Ghana and Zimbabwe since the UK left the EU single market at the end of 2020. A post-Brexit surge in the number of health professionals from red list countries working in England has sparked criticism that hiring so many is unethical and immoral and will damage those countries' health systems. That's a very good point when we think about when you think about it. We don't think about the repercussions of these countries, these much poorer countries that do have very good workers, and you entice them. Yes, our pay is not as good as some of the other European countries, but if they get offered to come to the UK and they get paid better than where they are, that means that there's one less health professional in their country that might need them. So that is a very, very valid point there. So this is the NHS is recruiting more staff from red list countries. Staff from red list countries employed in NHS English, NHS Trust and integrated care bonds there. So you have support staff 12,405 in March 2023. It's now 21,600 in the last reported at November last year. Nurses and health visitors, it was 15,860. It's now 21,500. Doctors was 11,000, now 13,000. Other staff was 5,680 and now 8,835. It also says that this sources from the Nuffield Trust. Support staff are most likely to be healthcare and nursing assistants there, just for a reference there. So the big jump means that the NHS now employs 65,610 staff from the WHO's 55 red list countries in its 1.5 million strong workforce. It has taken on 32,935 of those since the start of 2021, including 20,665 who joined in the 20 months between March 2023 and November 2024 alone, according to NHS figures obtained by the Nuffield Trust Health think tank. The growth is red list origin staff has been so dramatic that 1 in 11, that's 9% of all medics in England, are now from red list states, and 2/3, 46,890 of all the nurses who began working in the UK between January 2021 and September 2024 were trained outside the UK and economic area. Now, since 2018, there has been a 46% jump in the number of nurses from Nigeria and a 21% rise from those from Ghana and a 60% rise from Zimbabwe. Yeah, of course, because we don't have the workers anymore from the EU, from the European countries, we're getting them from abroad, further afield. Mark Dolgan, a policy analyst at the think tank and Brexit programme led, said recruiting on this scale from countries the World Health Organization believes have troubling few staff is difficult to justify ethically for a still much wealthier country. Yet again, Britain fails to train enough healthcare staff has been bailed out by those trained overseas. So this graph here, this is the number of registered doctors from outside the UK in Europe, doubled between 2014 and 2024. This is registered doctors in the UK by region and primary medical qualifications here. So you have the red bar, which is international medical graduates. You have the dark blue bar, which is European Economic Area, and then you have the blue bar there for the UK there. And you can see there that pretty much since 2014, you can see there the numbers there. They've been highlighted. That's for the UK. Has slowly gone up and up and up. There you can see from the EU, it has increased as well, but nowhere near, not as high as obviously us. And then you have international medical graduates there as well. Those numbers there as well. Excuse. The ending of the free movement of labour into the UK by EU nationals from the start of 2021 has created a diagnosis of over-reliance by the NHS on clinicians from red list countries in Africa, Asia and the Pacific. The think tank reports on the health of the UK after Brexit says, particularly since the end of free movement of labour at the end of 2021, a remarkable steep and sustainable increase in staff trained or holding nationalities outside the UK and EU has occurred, said the report, published on Friday. NHS England figures, which the think tank obtained under the Freedom of Information Law, shows that the number of red list nurses working in England rose 36% to 21,500 between March 2023 and November 2024. The number of doctors increased over the same period by 24% to 13,675, while the number of staff who supported doctors and nurses soared by 74% to 21,600. That's a massive jump. we keep hearing this. This is one of the things that, if we want to use our own doctors and nurses, we have not only it's all well and good for us here in England and our nation talking about training our own healthcare professionals to become doctors and nurses, but if we don't retain them, if we're not paying them enough, if we're not giving them the benefits of being our workers within our national healthcare service, what is the point? And we are. This is also. I look at this as well as a lot of. This is a lot of money I see as well being wasted when we're not doing enough to retain and hold on to the doctors and nurses and other NHS staff that we have. Proportion of nurses in the UK from outside the country and Europe has increased since 2021. This is the number of professionals on the Nursing Medical Council register. So you have the red bar there for the rest of the world. You have the EU and the EEA, and that's the European Economic Area, and you have the UK there. And from 2016 to 2024, again, you can see there the numbers has increased there. Numbers have increased, obviously. Numbers have actually decreased there for the EU and the EEA there. And then for the rest of the world, it's actually gone up quite significantly as well. But yeah, for us, yeah, it's still on the up. The findings raised question about whether the NHS is adhering to the WHO's edict to not actively recruit health professionals from the 55 countries, which have been endorsed by the Department of Health and Social Care on behalf of the UK government. The WHO advises against recruitment from those countries because they face the most pressing health workforce challenges related to universal health coverage and have too few personnel to care properly for their own populations. The figures prompted West Street to accuse the NHS of acting in an immoral way of depriving needy countries of homegrown health professionals. The NHS has been left in an immoral position of pinching doctors and nurses from countries which desperately need them because the Conservatives couldn't be bothered to train enough medics, the Health Secretary has said. I don't think it's just enough about, like, it's easy to pin this on the Conservatives, obviously, and you can rightly pin this on the Conservatives. But you also have to remember is that, and this is where it ties into the whole cost of living crisis, guys, because I do have to bring it up here. When things cost too much money, when things cost too much, you're going to, if you have an opportunity to earn more money, which is, for example, going, instead of working for the NHS, you're working in the private healthcare sector in England, where you get more money, you're going to take that opportunity rather than work for the NHS because guess what? There's more money in your pocket, and you need that more money in your pocket because guess what? Bills are going up. The cost of living plays an important part in all of this as well. So it's yes, the Conservatives caused all this. I accept that, but you have to factor that in. And yes, of course, Brexit and global events as well is also a factor as well. At the same time, straight A students in this country have been locked out of medical school, and we're failing to bring enough young people into the nursing and caring profession. I agree with that. He said he was determined to reduce the NHS reliance on recruitments from red list countries by investing on training the next generation of NHS staff through our plan for change. Officials drawing up a revised version of the NHS long-term workforce plan published by the previous Conservative government in 2023, which included a major expansion of UK trained staff. This all sounds good, but whether it actually comes to fruition is another thing. Aging populations worldwide have created a global race to hire doctors, nurses, healthcare assistants, and other specialist staff, with rich nations increasingly turning to staff trained in Asia and Africa. 10 high-income countries, including the UK, US, Australia, and Saudi Arabia, account for 70% of the global migration of health professionals. Yeah, so basically those countries are stealing the most there from what they're gathering. Sebastian Reeves, the head of health at the IPPR think tank, says, while the NHS benefits hugely from the experience and skills of staff trained overseas, its over-reliance on recruitment from red list countries is both unethical and unsustainable. Recruiting from these countries risks damaging fragile healthcare systems and undermines long-standing efforts to extend medical care to those who need it the most, the world's poorest. However, Jim Campbell, the WHO's Director of Workforce, says many of the red list staff have applied directly for jobs in the UK and therefore unethical recruitment by the NHS, which is much less common than the Nuffield Trust overall numbers suggested. This is startling data and raises ethical questions, but behind the headline data, there's a lot of discussion going on between the UK and other governments about graduates seeking career opportunities by joining the NHS and doing jobs that they wouldn't be able to do in their own countries. There's a lot of people in that category, he said. And that's the thing. If people want the opportunity, those opportunities. Excuse me. People want if there's better opportunities somewhere else, they're going to take that if the opportunity presents itself to them. But the question is the UK doing that intentionally, or have they been doing it intentionally under the Conservatives, because the Conservatives couldn't be bothered to raise the money needed to actually build our own NHS workforce? And I agree with that. I do agree that the Conservatives did not want to, because they didn't want to spend. The Conservatives don't like spending; they like hoarding the money. While this Labour government is spending money. It is spending money. Obviously, at the same time, they're trying to balance the books and all that stuff. But I do agree that the Conservatives have left this in a mess. I don't trust fresh treating, like I said, but it is also there's a side of me that's just like it's really, really sad, because obviously we're taking healthcare workers from some of the poorest countries in Africa that are really having so many problems right now. Many diseases, many issues, and they need these healthcare professionals to look after themselves, their own countries. But when they get an opportunity, if these doctors and nurses, money tends to win every single time. If there's an opportunity for you to earn more money, you're going to take that opportunity. And that's just a fundamental fact. But what do you guys think? What do you guys make of the situation around our National Healthcare Service in England in particular? Do you blame the Conservatives for bringing in doctors and nurses from outside the EU? Are we still too much reliant on them? Do you think that maybe this government might get a grip on it? Let me know your thoughts on this and more down in the comments below. If you haven't already, please hit that like button, share across social media, subscribe if you haven't too already. Do check out the Patreon and Rumble for exclusive content on those platforms. And if you want to go one step further and support me financially, you can join the YouTube membership for 99p too. Thank you all so much for watching, and I hope to catch you all very, very soon.